we're not going to inject CBD IV. We haven't gotten to that point, but the next best available component of bioavailability is a meter dose inhaler. And how does that work? So we all have what we call our respiratory system, and our lungs are made up of these alveoli, which are air sacs, and that's where gas exchange occurs, and you get direct absorptivity of a product into your blood system, and that's 98% bioavailability that occurs completely within 5 to 10 minutes. So you get peak plasma concentrations within 5 to 10 minutes of using an inhaler because it gets directly into those air sacs where gas exchange is occurring. So what makes this meter dose inhaler unique? Well, it's backed by an FDA component methodology, and the actual device is FDA approved, which is completely unique. It's the most cost-effective dosing that we have because it's basically, you know that, hey, if I take one inhalation, I'm going to end up getting that dose to a 99.9% bioavailability component. So I know Barry had asked a question earlier, or someone had asked a question earlier, if someone has lung disease and they only have 65% capacity of their lung, or they have interpulmonary embolisms and they only have, 80% of their lung capacity, it's irrelevant of that fact that the inhaler is safe enough that it is going to go ahead and occupy most of those air sacs that are available. And you'll still get that full bioavailability of the capacity of the lung that you do have available without causing any harm. Plus, you're getting safe and accurate dosing, which is very, very important, right? So if I know I want to dose 10 milligrams to a patient, then I'm going to tell them you're going to do 2 inhalations, and you get direct measuring without any messy using a pipette or trying to dose through a mixed drink or something of that nature where you're not knowing what you're going to exactly get. Plus, we're using pure CBD isolate versus a full spectrum oil, so you know you're getting the best quality component. And the best part is it's fast acting. So if I know I want to take something because I hurt my knee, I can certainly use a balm and rub it into my knee and hope I get, bioabsorption of that product and hope I get an effect pretty quickly. But with this inhaler, I know I'm going to get an effect immediately where my plasma concentrations are going to go up within 5 to 10 minutes, which is a unique thing altogether. So all those things being said, I do have a sample of an inhaler here. So I'm going to kind of show and make sure everyone's utilizing the product effectively. I've done this for patients too. So the first thing is you have to learn and create an L with your hand. And that's how you're going to end up grasping it, where you pinch it just like this. You're going to remove, before you remove the cap, you're going to shake it for a good 10 seconds so you're getting the full concentration of that product. You're going to obviously remove the cap. What you're going to do prior to taking this inhalation is you're going to do a full exhalation. So you're going to exhale fully. Next, you'll take the product, and I'll turn so you can see. You're basically going to take your teeth, cap it, and you're going to close your lips on that product completely. And by doing that, you've closed the air leak, that potential that can occur. So you'll exhale fully, put the product, cap it, and when you cap it, you're going to push down on it. And when you push down on it, you're going to slowly inhale. And you're going to do that very slowly. So I'll do it so you guys can see exactly what I'm going to end up doing. So exhale, cap. So what I ended up doing is I held my breath. So slowly I'll inhale that product in, and I'm inhaling through my nose and then holding the product in for 10 seconds to get that deep inhalation down into the lungs. And then you'll hold your breath for 10 seconds. If you can't hold it for 10 seconds, that's fine. And then once you're done with that inhalation, you can breathe normally through your mouth or through your nose. And then if someone that's 5 milligrams. So if I recommend someone to take 10 milligrams, I always advise them to wait 30 seconds before they do the next dose. And that'll allow the lungs to adapt and get that directly into the lungs. So that's a good methodology, and you'll get a good effective dose that gets down into your alveoli, and you'll see the immediate effect of that dosing. So Barry, that gives a good consensus of both the DNA technology I wanted to talk about, as well as the meter dose inhaler, along with me kind of depicting how it should be best utilized.